I'm Anita Charlesworth, Chief Economist at the Health Foundation, and I'm co-author of this report, Hospital Finances and Productivity in a Critical Condition. In this new analysis, we analyse the financial performance and productivity of NHS providers. NHS providers are the organisations which are responsible for delivering and managing care in our hospitals, community nursing services, ambulances and mental health. There are 247 NHS providers. These include foundation trusts and NHS trusts. In this research, we've looked at their audited accounts and their reference cost returns to examine how they're doing financially and their productivity. For the productivity analysis, we've focused on acute and specialist hospitals, but we've also had a look at mental health providers. The work covers the period 2009-10 to 2013-14, but we also look at data for the first 9 months of this financial year, 2014-15. Recent years have seen a very sharp deterioration in the financial performance of NHS providers. So in 2012-13, NHS providers underspent by £582 million. But by the end of Q3 2014-15, this had deteriorated to a deficit of £789 million. The problems are most focused in our acute hospitals, where 3/4 of acute hospitals were in deficit at the end of Q3. And for this financial year, the NHS as a whole is projecting a deficit of £626 million. NHS providers are in deficit because their operating costs have increased by more than their income. In 2013-14, operating costs rose by £1.4 billion, whilst income only rose by £700 million. The biggest increase was in their staff costs, but this is not the result of pay. As this slide shows, NHS pay fell in real terms between 2009-10 and 2013-14, in line with the government's policy of pay restraint across the public sector. And the public sector was not alone in facing pay restraint. Private sector earnings fell in real terms even more sharply through this period. NHS providers' pay costs rose because the number of people they employed increased. Permanent staff rose by 2.3% in 2013-14, with the largest increases in nursing, especially nurses who work in acute hospitals and those who work with older people. But the big rise was in temporary staff, which rose by 15.8%. As the chart shows, spending on temporary staff rose across all forms of acute hospitals, from small hospitals to the specialist, but the use of temporary staff is greatest in small acutes. The cost of employing temporary staff varies across the country. It's highest in London, where 14% of the staff budget goes on temporary staff, and lowest in the North East and South Central. The deteriorating financial position of acute hospitals is mirrored in their productivity performance. We've examined the productivity of 160 acute and specialist hospitals between 2009-10 and 2013-14. Productivity looks at the ratio of outputs to inputs. As this chart shows, although productivity increased in the first 2 years of this Parliament, crude productivity fell by almost 1% in both 2012 and 2013. Crude productivity means that this productivity does not allow for any change in the quality of care, but simply focuses on outputs. Productivity varies across the country. Compared to the national average, hospitals in London, the North East, South Central and East Midlands were the least productive, whilst those in the West Midlands, the North West and the South West were the most productive. Productivity also varies by type of hospital. Smaller hospitals were 3% more productive than average in 2013-14, with medium and large size hospitals less productive. Efficiency measures the amount of output delivered for a given amount of spending. Our analysis shows that efficiency has improved in the NHS over recent years. Amongst acute hospitals, efficiency improvements averaged just under 0.4% a year between 2009-10 and 2013-14. This is substantially below previous estimates. Work by Deloitte for Monitor and NHS England looked at the rate of efficiency improvement between 2008-9 and 2012-13. In that work, they found that efficiency improved by an average of 1.2% a year. We have also analysed the productivity of the 51 NHS trusts that provide mental health services. Mental health data is available for a shorter time period, and we've focused on the change in both output and inputs between 2012 and 2013. This work shows that mental health hospitals' activity increased by 0.7% between these 2 years, whilst their costs actually fell in real terms by 3%. As a result of this, crude productivity, that's the ratio of their outputs to inputs, showed an annual improvement of 3.7%. Our research shows that the NHS has become more efficient over the last 4 years, but it's also clear that the system is under considerable financial strain, with a projected deficit of over £600 million in 2014-15. Biggest strain is being felt in our acute hospitals, where after improvements in productivity in the early years of this Parliament, crude productivity appears to have fallen by 1% a year in both 2012 and 2013. The key factor driving this reduction in productivity would appear to be increased spending on staff, and largely spending on temporary staff. Over the next Parliament, NHS leaders are seeking to deliver 2 to 3% a year of productivity improvements. This amounts to £22 billion worth of efficiency gain over the next 5 years. If the NHS is able to deliver improvements at this rate, they estimate that the service will need an additional £8 billion by the end of the decade. Delivering productivity growth at this rate will be a huge challenge and almost certainly require a very different approach to and focus on productivity improvement over the next 5 years. For further information, download our report at the Health Foundation website.